Welcome to our bi-monthly spinal cord injury in service. Today we'll be led by Dr. CJ Carcuffe, and he'll be discussing exoskeleton-based rehabilitation after spinal cord injury. As usual, all of our lectures are posted on the YouTube channel. If you want to go back and review any, they're all available. So with that, I will hand it off to Dr. Carcuffe.
All right. Thank you, Dr. Abramoff. Yes, thanks for your introduction. I'll be talking about exoskeleton-based rehab after SCI. So just a couple of objectives I want to go through over the course of this talk, just starting off by defining what an exoskeleton is, then go through an overview of the current FDA-approved brands that are on the market and available for use in this population. And then I'll end it with outlining the different benefits with exoskeleton used in the rehab setting for within the SCI population. To start things off, exoskeletons are an assistive robotic technology that can provide powered hip, knee, and ankle motion in individuals with spinal cord injury to initiate and control basic locomotion. This includes standing upright, walking, turning, climbing and descending stairs. And some other FDA-approved conditions other than spinal cord injury are TBI, acquired brain injury, stroke, MS, and other progressive neuromuscular diseases. But the vast majority of indications, I believe up to like 36%, are for spinal cord injury. So as of March 23rd, looks like 11 exoskeletons have been FDA approved for walking, gait assistance, and physical rehab. And then this is a definition put forward by the FDA specifically, that a powered skeleton is a prescription device that is composed of external powered motorized orthosis that is placed over persons paralyzed or weakened lower extremity limbs for medical purposes. And from that same article, these are the 11 brands that are currently on the market. Some of the more popular, well-studied ones are the Indigo, the Rewalk, and the Exo NR. And then these ones with the asterisk, the Indigo and the Rewalk, are also FDA approved for home use or personal use. The remainder are all need to be used under professional health care and a trained individual. And then I put here for the Adelante, it is the only self-balancing exoskeleton that's on the market. So the other ones need to be used in context of crutches or rolling walk or some type of walker. And then one of them also is approved for just use with a cane. And I'll go over the individual ones in a little bit more detail, some of the more well-known ones. And then on the right here is just kind of a pie chart showing the different types or the different uses or abilities that the exoskeletons give. So most of them provide function at the hip and the knee joint. Some are hip, knee, and ankle, while others are just single joint hip, knee, or ankle. And then if you kind of do a deeper dive into some of the websites for these, they also have single limb devices. Some of them are trying to develop upper extremity devices, but it all kind of started with lower extremities, kind of at the hip and knee, and then other types of things came out. So just to kind of highlight some specifics for some of the other ones, and it's kind of reiterating what I just said, but the Rewalk Personal and Indigo are the models that are approved for home and personal use. The rest are with the trained healthcare professionals, and regardless, it needs to be used with total supervision. So an individual could not be walking around by themselves in the house with these devices. Somebody needs to be there watching them. The Adelante is self-balancing, but it does need to be used with a safety rail. The HAL for medical use is an exoskeleton that needs to be tethered. Usually it's an overhead body weight support system. And I have some pictures of that just to show you some examples. And then all of them need to be used besides the Adelante with crutches or a walker, like I said, but the Exo NR is also approved for a cane. They mentioned that some of these could accommodate an adolescent-sized individual, but there are no pediatric versions currently FDA approved or on the market. And then this goes through the top three that I kind of mentioned before. So in addition to providing support at either the hip, knee, ankle, or some combination, some of them are also broken down into indication based on injury level. So here you can see the rewalk in the rehab setting is indicated for T4 to L5 injury level of injury, and then personal use is T7 to L5. And then you can see for the EXO, they also kind of take that out to whether it's an Asia A through D classification. And recently, I believe, so this is saying the Indigo is owned by the Parker Hannifin Corporation, but I saw that it was actually just acquired by the Exo Bionics company. So it looks like they're kind of consolidating the market in terms of that as well. So this is a picture of the rewalk on the left here without a person in it. Obviously, you can see there's a hip and a knee joint, and then just support at the foot. And then this is in while with someone wearing it, obviously using forearm crutches to ambulate. The Indigo is fairly similar. Then this individual here is using it with a walker in a rehab setting. And then this is the Exo NR. And as I mentioned, you can use this one with a single point cane, which this individual is using in a rehab setting. Some other differences, I noticed it kind of has more of like a backpack orientation, more support in the back, and kind of goes over the shoulders, whereas the other two just wrapped around the waist. This is the HAL for medical use. So as I said, you tether that above the, it's like a body weight support, a little bit different, aesthetics. This one's white while the other ones are all black, but it's the same type of joints at the hip and at the knee. And then this is the self-balancing Atalante. See, it's a little bit bulkier, especially in like the distal lower extremities here. And then the person who's, trying to reach and grab a ball, it's allowing him to balance without any supports, or he's reaching to touch this guy's hand over here. So a little bit more sophisticated in terms of that ability. I didn't find anything like breaking down cost for all of them, but these are a chart I pulled from one of the articles I was looking at, and just showing kind of how cost prohibitive these types of things are. As we know, orthoses, prosthetics, they're pretty expensive for individuals. And then this just kind of put some of them all kind of succinctly in one chart here. So the Indigo, the Exo, and the Rewalk are kind of like the top three that I saw come. It's like their most studied top exoskeletons that are on the market. The Honda Walking Assist, I guess, kind of takes a page out of the car payment book, showing $375 monthly. But they're pretty expensive devices. So there was a meta-analysis done, Miller et al. In 2016, just looking at the safety and efficacy of the various exoskeleton devices. Their meta-analysis incorporated 14 studies looking at 111 patients. I just kind of broke it down here. You can see 8 were with the Rewalk, 3 with Exo, 2 with Indigo, and then 1 was unspecified. Some of the safety concerns are, pressure injuries or different types of just like injuries that can happen by wearing the device itself in the SCI population, and then also looking at falls, fractures, and overall they concluded that these devices are safe to use. The injury is the chance of injury is very low, and they can provide significant health benefits, especially secondary health benefits when it comes to the SCI population. So I'm going to go through each of these individually, but the benefits that were highlighted in the readings that I did were in regards to spasticity, musculoskeletal benefits, benefits with pain, both nociceptive and neuropathic pain, cardiovascular health, neurogenic bowel, and physical function and overall well-being. So looking a little bit into spasticity, as we know, it's a velocity-dependent increase in muscle tone and tendon reflexes. This is a very common complication in SCI, reported to be anywhere from 66 to 78% of patients. studies were variable, and as a common theme with studying these topics is they're very small sample sizes. It's difficult to compare the heterogeneous population within SCI. But some studies did demonstrate an objective improvement in spasticity scores as measured by the modified Ashworth scale, but it was variable. One kind of showed that they had benefit after training, but once the training program ended, they kind of reverted back to their baseline levels of spasticity within 4 weeks. And then there were other studies that really just showed no improvement at all. So while it might be equivocal looking at the whole body of literature, there were potential benefits. So I think as they just have more robust studies, more sample size, bigger sample sizes, that's something that they can continue to work on and look at. Musculoskeletal benefits. So just being in having a wheelchair for a prolonged period of time can be shown to decrease bone mineral density. Anywhere between 25 to 46% of patients demonstrate this. Decreased muscle mass, and then just overall weight gain and increase in body fat percentage. This places the spinal cord injury patients at a risk for fractures and other metabolic complications. But again, small sample sizes. Several studies did demonstrate that there was an improvement or at least a maintenance in body composition, building some lean muscle mass, as well as maintaining or improving bone mineral density or improving metabolic profiles after 6 weeks of exoskeleton use. And then looking at pain here, so both chronic and neuropathic pain is extremely common. Anywhere from 26 to up to 96% of individuals experience some type of pain, and it's very difficult to treat. Even with multimodal approaches to treatment, psychological, medication, therapy, about 5 to 37% of patients report refractory pain symptoms. So exoskeleton use has been shown to reduce the intensity of both neuropathic and nociceptive pain. There was a pilot study done with a Rewalk that after each individual training session, patients reported improvement in their pain scores. There was another randomized controlled trial that the goal was to compare strength training versus gait training with exoskeleton. And although it didn't show that the exoskeleton was better necessarily, it showed that there was a equal reduction in pain scores, though there was no statistical difference between the two groups. And then there was a case study that just looked at 2 individual patients that were using that HAL device, which is the device that's tethered overhead. And they did show that they had improvements in their pain relief. And, they were able to come off some medications up to a year after they went through that training program. Some studies did show complications with the devices, though, and I kind of alluded this before when I was talking about the safety, but in some cases, the device itself was a pain generator based on new different types of pressure points, just being up in an upright position. There's a lot of points of contact between the device and the body, which can cause some issues. And then they also demonstrated that to really get adequate pain relief, especially when it came to neuropathic pain, it did require long durations of exoskeleton treatment protocols. So I think one looked at, they trialed it for like a 4-week period, and the patients didn't really report much pain relief. It's really more long-term treatment plans. When it comes to cardiovascular health, again, SCI patients are at increased and accelerated risk of cardiovascular disease, and exoskeletons provide an option for these individuals to partake in physical activity that they wouldn't otherwise be able to do. And as we know, exercise is a great way to prevent issues with cardiovascular disease, kind of stave things off. So the increased heart rate associated with walking with an exoskeleton device has been shown to benefit patients' cardiovascular health in the SCI population. These were cohort studies, and again, small sample sizes. They found that it was very energy dependent and dependent on the energy expenditure. So if a patient was able to walk at a pace that was exerting enough where their heart rate was able to increase, versus those who maybe weren't able to use the device as well, and it was just kind of a slower walk or a pace that didn't provide that increased metabolic demand with cardio workout. So it was very effort dependent, and therefore it makes it difficult to study. Then looking at neurogenic bowel, another very common secondary complication with SCI patients. Many studies, not really in the context of the exoskeleton, but just in general, demonstrate the benefit of being in an upright posture and increased mobility with its effect on bowel motility. And then that is the basis for the benefit in this context. So there was one group in 2015 that was able to demonstrate that just 20 minutes of rehab with the exoskeleton allowed them to reduce the enema dose and also time to defecation for those patients. Other studies also reported subjective improvements in the regularity of the bowel movements in their patient population. And then finally, physical function and well-being. The article commented that many times the main priority for a patient who underwent a spinal cord injury, their main top priority is to walk again. So just kind of having the ability to wear an exoskeleton is a viable option to kind of make that priority become a reality, regardless of the severity of paralysis. So even though the benefits in other ways might be more equivocal, it just allows that person to, get on their feet again, feel like they're experiencing walking. As a medical student, there was a patient at Moss Rehab that was able to use an exoskeleton that they had there, and just kind of watching his demeanor. He was a younger kid. It was a diving injury. He used to be a Boy Scout, and this was like a really big lifestyle change for him, as it would be for anybody. But it was pretty cool to watch kind of just his emotions in general, and what he went through using the exoskeleton. It was something he was really excited about. So many studies have shown positive changes in the perceived activity limitations, overall emotions, and quality of life of these patients after they get to use the exoskeleton. It's kind of just looking ahead. Obviously, cost is a major limiting factor for use, not just personal or at home, but also in the rehab setting. The body of research is pretty limited to small sample sizes. It's very difficult to study because even within a spinal cord injury population, there's a lot of heterogeneity, but there has been shown to be some secondary benefit. So I think as these, the accessibility increases, they're able to have more patients use these devices. They kind of work out the kinks as they come out with new generations. I think the Rewalk is on its 6th generation right now. It seems like the technology is improving in terms of safety and benefit, but again, it really comes down to just the accessibility and making it available to people. And that's all I got. Thank you for tuning in.
So like this nurse tech.
Hey, CJ, can I ask a question?
Sure.
Thanks for the presentation. I'm actually at CHOP right now. We have a patient that we're trying to see if we can get an exoskeleton, sort of like a Make-A-Wish. Did you come across any of this use in peds?
So specifically, I mean, they said that there are no exoskeletons for the pediatric population right now. I think it kind of depends, because they did say that there were patients that, like adolescents, that would be able to be accommodated in some of the sizes. But unfortunately, it doesn't seem like there's any FDA approval, at least for pediatric models. I'm sure some people are trying to work on it.
She's like 14.
Okay. Yeah, they probably are not FDA approved at this point. At least at the time of the article that I read, it was from March of 2023. But Dr. Abramoff might know something a little bit more about that.
Yeah, I don't believe they're approved in the pediatric population, but certainly if it's an adolescent and they fit size-wise, I don't see that being a major limitation.
Hi, sorry. So I'm with Erica today. This is Rose. I'm one of the PAs. I was talking to Erica just about her one like wish is to walk. And so I didn't know if it's something where using a oncology foundation to be able to, let's say, rent one of them, not necessarily as like they get it through insurance or anything like this would be like through a foundation, or if they raise that money to be able to rent it or buy it for her last couple months of life. So that's why we were like questioning that.
Yeah, I mean, there was like one chart I had that pulled some prices of them, the different models. It looked like the Honda brand was the only one that kind of had a monthly price, but I'm sure there's like other leasing options or I find it hard to believe they wouldn't at least try to accommodate something like that, so you wouldn't have to buy the whole thing outright.
Yeah.
Okay, thanks, CJ.
I went on a lot of different websites. They're very user friendly. They're trying to make it accessible. So
It's good.
That whole list of brands,
Yeah, I'm not familiar with
Boring.
any like leasing programs per se, particularly to individuals, maybe to like healthcare systems. I would certainly, think about reaching out to the major spinal cord injury foundations, Christopher Reeve, Craig H. Nielsen, see if they have any thoughts. I kind of doubt it, but you could see if Goodwill, the medical Goodwill in New Jersey has anything. I highly, highly doubt it. Make a Wish is a really good idea. And then the vendors at for like Rewalk and Indigo, they're very responsive. So if you reach out to them, they may have some good ideas.
Okay. Yeah. Thanks, Dr. Imam. Thanks, CJ.
Yeah. Thank you for the questions. I hope.
What other questions do people have? So should you be offering this to everybody with a spinal cord injury? And who should you be offering it to, and who should you not be offering it to?
I think it's very specific in the context of rehab. I think something you need to be wary of is wounds, because just making sure that points of contact with the device, if somebody has a really bad pressure injury, you don't want to make those types of things work. I think it's really important that the person who's using the device is capable of like training on it and having the enough like compliance with like following rules and doing the things that they're supposed to do and listening to directions, because you could definitely injure yourself if you're not doing things appropriately. Obviously they have to be able to tolerate an upright position. So if they're like somebody who gets extremely orthostatic, or that's not something that they're able to, symptomatically handle, that would be inappropriate for them.
Yeah, and I'd also add people with like low bone mineral density, particularly if they have contractures. The contractures I'm more worried about over the low bone mineral density. But my question was more about not contraindications, but would you recommend this for anyone with a spinal cord injury?
I mean, I think it's worth trialing if somebody's interested. If you have it at your facility and the person wants to give it a go, I don't see any reason why I wouldn't at least trial it.
Would you seek it out? Would you encourage your patients to seek it out?
I don't think I would. If it was like if there was financial issues with it, or if, I don't think it necessarily, the research doesn't back up benefits enough where people should be hunting them down just yet. But I think it's kind of just a tool in the toolbox that, like, if it's there, if it's available to your program, it's worth just trying and having somebody strap into it. But I don't think it's absolutely essential for SCI rehab at this point.
Yeah, I mean, I pretty much agree with that overall. I think there's certainly some patients who get a lot of benefit from it, particularly from that like psychological perspective. Patients who have had this at home, oftentimes, they mostly use the wheelchair, and this is more therapeutic because it's easier, it's faster to get in their wheelchair. And there is some concern if you bring this in too early, are you really diminishing time for necessary skills like wheelchair skills and bowel bladder type skills and dressing and ADLs, and is this the best use of someone's time and energy. But it's an exciting time that now Medicare is approving it for home use, and I think that's going to really change the usage of these products and the uptake. So thank you so much, Dr. Carcuffe. Any last thoughts?
Nope. Appreciate it.
All right. Thanks, everybody. And we'll be back in a couple months. Bye.